Complaints about side effects from cosmetics more than doubled last year, yet most of these products are still on store shelves. Dr. Tara Narula has been following this. Tara, what types of products are we talking about and what kinds of reactions are people having?
We're talking about products that we use every day: makeup, moisturizers, deodorant, perfumes, hair care, and coloring products. In this analysis, they found that from 2015 to 2016, the adverse events doubled from around 700 that year in 2015 to around 1,500 in 2016.
Which still doesn't seem like very many.
It doesn't, but the authors of the paper suggest that we're really seeing the tip of the iceberg, that typically research shows that we get reports of under 10% of the total amount of adverse events. The reactions we're talking about range from skin itching, irritation, rashes, to hair loss, to allergic reactions, and then longer-term concerns about cancer, reproductive effects, or endocrine or hormone disruptions.
What kind of oversight is there, Tara, for these products?
There's really minimal oversight, and that's the problem. And I think a lot of people would be surprised by that. When you look at how this industry is regulated, it's really self-regulated. They are self-policing. And the biggest issue is that manufacturers are not required to give consumer complaints over to the FDA. They don't have to report it. And so what we have is a passive surveillance system where essentially the FDA is waiting for consumer complaints or for complaints from public health officials or doctors, and then eliciting investigations.
So, Tara, what can consumers do to protect themselves?
It's really hard for consumers to navigate the labels. So one of the things they can do is look for products that have the least number of ingredients to limit the concern for reactions to ingredients. They can also look for products that don't have dyes, fragrances, or preservatives. The best things that consumers can do is to go to the FDA website and file a report if they have an adverse event, because what might be a rash for me might be a more serious problem for you. And the only way the FDA is going to get a clear picture of what's going on is with more data.
Great advice. Dr. Tara Narula, thanks very much.